A couple of disclosures before we begin. This is an informational presentation. It's not substitute for medical advice. So please see your doctor for any specific questions that may apply to you. And we are going to be discussing the off label use of ketamine in this presentation. And so our presentation is the ketamine story, transforming treatment for mood disorders and pain. Just a couple things. Some Zoom functionality may be limited, and we promise that we will email you a link to the recordings. So you'll have that. You can watch it again at your own time. And our presentation will be going over all about ketamine. So the past, from anesthesia to therapy, the present, talking about ketamine therapy today, the future, the next evolution of ketamine, and then we're going to finish with that Q&A portion. A little bit about who we are. So we have Dr. Glareh Imani, who is a board certified emergency physician and the founder of Namine Infusion in Goodyear, Arizona. She also has a background in osteopathic medicine as well as neuroscience. She has been recognized for her teaching excellence in Florida. She's very active in medical education, disaster, wilderness medicine, international medical missions. And she does all of this while balancing her professional life with a passion for fitness, travel, and family. In addition, we have Dr. Rivas, who is the founder of Inner Bloom Ketamine Therapy in San Luis Obispo. He's a former trauma surgeon who previously practiced in Austin, Texas, as well as Santa Maria, California. He really embraced the ketamine work after seeing its effectiveness during trauma surgery, as well as some personal battles with anxiety and depression, which led to his career change. In addition, twice a year, he does perform volunteer surgery with the Flying Samaritans, which is a nonprofit organization. And then you have me, and I'm the founder at Reset Ketamine in Palm Springs. I've been working with ketamine since 2018 at the clinic, and even before that in the ER setting. So let's get right into the ketamine story. And so first, we're going to start with the history, and I'm going to pass the microphone over to Dr. Imani.
Thank you, Dr. Ko, for that introduction. I'm going to go over a brief history of ketamine, which started back in 1956 with a medication called phencyclidine, or as most people know it as PCP. PCP was used as an anesthetic in the operating rooms, but the doctors noticed bizarre psychotic symptoms lasting hours as patients were coming off sedation. So at this point, Parke-Davis Pharmaceutical hired Dr. Calvin Lee Stevens to refine the drug with less side effects and shorter acting side effects. He came up with multiple derivatives. One called ketamine, initially tested on animals, showed promise. Some might have heard of it as horse tranquilizer. In 1964, first humans were given IV ketamine, and these were the volunteer prisoners at Jackson Prison. After ketamine became FDA approved in the 1970s under brand name Ketalar, not only was it used in the operating rooms, but it was also used in injured soldiers in the Vietnam War, mainly because of its margin of safety and no respiratory depression. This is when illicit abuse started in the West Coast as well. Between 1970 and 1990, it was widely used in the operating rooms until a landmark article came out in the 1990s showing its effectiveness as a procedural sedation medication in pediatric patients in the emergency room. Hence, that opened the door for the emergency room doctors to start using it as a procedural sedation medication. Due to the illicit use and abuse, FDA made ketamine a Class 3 scheduled drug. In the year 2000, the first randomized double-blinded study from Yale published on the antidepressant effects of ketamine. And then in 2012, researchers called ketamine the biggest breakthrough in depression research in half a century. Finally, in 2019, FDA approved the intranasal ketamine called S-ketamine for treatment of the resistant depression. Let's go over the mechanism of action of ketamine. The biological mechanism of action is the science part of it, where it blocks the activity of glutamate via the NMDA receptor, therefore increasing the BDNF growth factor, which stands for brain-derived neurotrophic factor, which helps with the regrowth and reconnecting between neurons, hence neurogenesis and neuroplasticity. Functional mechanism of action decreases the activity of the default mode network of the brain, therefore calming those negative ruminating thoughts and temporarily disconnecting from the ego. Psychological mechanism of action opens up the mind to access the unconscious, allowing you to process those difficult memories. And finally, the spiritual mechanism of action creates that mystical experience which fosters healing of the soul and reconnect to the universe, God, the source, which could potentially decrease the symptoms of pain, anxiety, and depression. Ketamine is known for its dissociative anesthetic quality. It induces a non-ordinary state of consciousness. There are 4 types of experiences one could have depending on the dosage and the mindset. First, the empathogenic experience. This is when you're still aware of your body. You feel comfortable, relaxed. You have decreased ego defenses. You feel empathy, love, compassion, peace, the overall sense of euphoria. The second one is out-of-body experience. This is where you have complete separation of the body and significantly decreased ego defenses. You can have intense visions, vivid dreams of the past or the future. Some can even relive their own birth process. And number 3, near-death experience. This one, you leave your body. You have complete ego dissolution and loss of identity. You experience being in a single point of consciousness, simply aware of itself. And last, ego dissolving transcendental experience. This is complete dissolution of boundaries between self and external reality. It is the collective consciousness, unity with nature and universe. So as you can see, no 2 experiences are the same. Even with multiple infusions with the same individual, you get different experiences. We have seen in our patients, the more profound the experience, the more change and improvement they have in their symptoms and daily life. Ketamine works on many levels and through different mechanisms, which could explain why it works so well compared to traditional treatments. And with that, I'm going to turn it back to Dr. Ko to present present day.
Thank you so much for that, Dr. Imani. Now I want to switch gears and talk about present day ketamine therapy. So we're going to be talking about what it's used for, the 3 S's of ketamine therapy. We're going to talk a little bit about the use versus misuse of ketamine, as well as ketamine in the media. So let's jump right in. What are we treating with ketamine these days? So we're focusing on mental health, for example, treatment-resistant depression, bipolar depression, PTSD, obsessive compulsive disorder, postpartum depression, and anxiety disorders, as well as some substance abuse disorders. At our clinics, we're seeing roughly 70 to 80% of patients responding to IV ketamine therapy. In addition to the mental health side, we're also treating some patients for chronic pain, such as fibromyalgia, complex regional pain syndrome, also known as reflex sympathetic dystrophy, postherpetic neuralgia, migraine headaches, neuropathic pain, trigeminal neuralgia. So as you'll notice, a lot of these nerve-related conditions. And so how do we treat these conditions? Well, let's get to the 3 S's that I had mentioned previously. So there's screening, there's the set and the setting, and I'm going to go into each one of those into detail. So first is screening, identifying those patients who can safely receive ketamine therapy. So someone will have those conditions that we had mentioned, plus they do not have any of the following conditions, such as uncontrolled hypertension, unstable heart disease, untreated thyroid disease, active substance abuse, active manic phase of bipolar disorder, untreated glaucoma, active delusions and hallucination symptoms, or even a strong family history of schizophrenia. So we really want to screen carefully so that it is appropriate for our patients. Going to the set. So set really refers to the mindset that one has, thinking about the person's motivations, their intentions, their beliefs, and kind of their emotional state that they are before the treatment. And one of the ways to prepare that set is with preparation and integration. So this mindset component is crucial. And for preparation, it can vary from clinic to clinic. So some examples, it might be detoxing from substances and activities that can affect the mind or the mood. Meditating can be powerful. Journaling and reflecting prior to the treatment, as well as encouraging and having a positive mindset. In addition, the intention is really one of the crucial components of this. Crafting a really clear goal and objective for their treatment, which comes from the individual themselves. So it's something that we recommend the patients repeat to themselves, almost like a mantra. Some examples: letting go of the past, more peace, more mobility, maybe to love myself a little bit more. Then there's the third S, which is the setting, the physical and social environment where the ketamine therapy occurs. So at our clinics, we really focus on the IV delivery. And one of the nice things about that is 100% bioavailable. In addition, we monitor all of our patients' vital signs, so cardiac rhythm, blood pressure, oxygen level, respiratory rate, just to make sure that it is absolutely safe. And then having trained medical professionals immediately available, present. And the beautiful thing about IV ketamine is that we can stop it at any time if needed, whether that's 10 minutes in, 20 minutes in. It's nice to be able to know that we can, get off the ride anytime we want. The social environment also plays a crucial role. We want the staff to be mentally, emotionally, fully present for all of our patients, and they need to be aware of those non-ordinary states of consciousness that Dr. Imani had previously mentioned. Now, I do want to talk about the use versus misuse of ketamine. So I know there's been a lot of media coverage with Matthew Perry, Elon Musk, Elijah McClain. And so that's one side of it where it can become sensationalized. However, you have to also look at the scientific data, which is kind of our area of expertise. So there's been publications in the New England Journal of Medicine, pharmaceuticals, a lot of well academic journals that have the scientific data with randomized, double blinded, placebo controlled trials. Now, I want to give you a metaphor to wrap it up here. And for example, let's say that you have two identical cars, and let's say there's two drivers. The first driver, let's call her Anna. Anna drives very responsibly. She always wears her seatbelt. She always goes the speed limit, checks her blind spot. Conversely, let's say you have a second driver. His name is Billy. And Billy is a little bit reckless. He may not wear his seatbelt. He may drink before he drives. He may not check his blind spot. He may go 10, 20, 30 miles over the speed limit. It's the same exact car, but it's about how responsible the individual drives it. So they could get safely from point A to point B, or alternatively, the car could become very dangerous and even a weapon at times. And with that, I will switch gears and pass over the mic to Dr. Ray Rivas.
Thank you, Dr. Ko. Well, now I want to talk a little bit about the potential future of ketamine therapy and some speculations I have in the industry. We'll talk about 6 key points: ketamine-assisted psychotherapy, ketamine for suicide, access, affordability, regulations, at-home ketamine use, broadening indications, and shifting to preventative medicine with prophylaxis. So I've noticed that ketamine clinics are starting to incorporate psychotherapy with their process. Prior to this, a lot of clinics relied solely on the medication and as such treated ketamine like any other antidepressant taken daily without mindfulness of use. But now ketamine clinics are starting to embrace psychotherapy, understanding there's a synergy between the two. I've also seen that ketamine clinics and providers are starting to deviate from the standard protocols. The standard protocols are typically a series of 6 infusions over a course of 2 to 6 weeks. But now some providers are interspacing more time for psychotherapy in between the medicine journeys to incorporate more integration work. I've also seen that ketamine clinics like ours are starting to include therapists during the medicine journeys, and not to conduct psychotherapy at that time, but instead to record what is said and what is experienced. Because these experiences can be very profound for patients, often filled with insight, motivation, memories, but they can also be very dreamlike. And if they don't record this or focus on it, it can be lost. So having a therapist during the journeys to record what is said and then brought up during a psychotherapy appointment after the fact can be very powerful. One of the key benefits of ketamine is it works very rapidly and very effectively for negative intrusive thoughts of self-harm and suicide. I foresee in the future we'll offer IV ketamine infusions to those who have suicidal ideation. And perhaps it'll be very protocol, evidence-based driven, similar to other emergencies such as a heart attack or a stroke. One of the key issues with access is affordability. Ketamine therapy is expensive. It requires a lot of staff, a lot of therapy. I recently attended a ketamine conference in Austin and was very pleased to see there was a lot of discussion on access and affordability. And I've noticed a lot of ketamine clinics and providers are starting to be creative, offering ketamine therapy in group settings or retreats. Or some companies such as Enthea are offering ketamine therapy as an employee health benefit, obviously with a lot of strict guidelines on practice and credentialing processes for the providers. Now, there's an ever-growing number of literature studies that support ketamine's use as being effective and safe. So I foresee in the future that insurance companies will start to recognize this and will eventually start to cover this. Because one difficulty that we face is IV ketamine is not covered by insurance. So we're very hopeful that this changes. Now, as Dr. Koh mentioned, there's a lot of news, some of it negative in regards to abuse, misuse, and addiction of ketamine. And I think that's perhaps largely in part because of these at-home ketamine businesses. I understand that a lot of them are, or some of them are geared towards improving access and affordability. However, a lot of them do seem to be very profit-driven. So I foresee more regulations, more restrictions on at-home ketamine use, or at least to the extent that it is today, with limited preparation, limited guidance, no monitoring, and little follow-up. Now, ask just about anyone who's undergone a series of infusions, and they'll often endorse improvements in other avenues of their life that they may have not came in for, such as depression, anxiety. That could include improvements in relationships, business, or creativity. I foresee that ketamine will be offered to those who are not technically ill, but instead to enrich the human experience. But again, with strict screening, guidance, and aftercare. And lastly, I've seen a lot of mention as far as ketamine being used as a prophylaxis. Studies have shown that ketamine is administered 1 week prior to a stressor or stressful event can have a protective effect. Ketamine has known anti-inflammatory properties, and there's a strong link with depression and inflammation. So perhaps we can start to use ketamine during a post-viral or post-infectious state to prevent lingering side effects or syndromes such as long COVID. Ketamine is commonly used in the perioperative period, meaning before, during, or after surgery, as a means to control pain. I foresee that this will be used even more commonly, perhaps prophylactically, in preparation, for example, a major surgery to prevent postoperative issues such as chronic pain. And lastly, I've seen mention of ketamine being used on combat soldiers, such as Ukrainian soldiers, as a means to prevent depression or prepare them for the possibility of death. The Ukrainian administrator of the rehabilitation center in Kyiv, the capital city of Ukraine, stated that soldiers who are prepared for the possibility of death are more effective and more likely to survive. So I'm very excited about the potential future of ketamine and new developments to come down the line. Let's move on to a Q&A. So Sam, can you give us a rundown on how this will unfold?
Sure. So thank you so much for that excellent envisioning of the future. And the way we'll do it is that I will state the question and then we'll just go in order with Dr. Imani, myself, and Dr. Rivas, and then we'll add on any additional feedback that we may have. So first question here is for, I'm going to answer live for Dr. Glareh. How do I know if I'm ready to get ketamine therapy?
That's a very personal question, in my opinion, because I feel like you have some people come in and say that I have tried everything and nothing has worked, and this is my last resort. Like, this is something that I have read about, that I know that if this doesn't work, then that's it, right? This is my last resort. And some people have heard other testimonials and they're like, you know what, I think that this would be a good option for me because I don't like taking medications, or, I'm doing therapy, psychotherapy, but if this is going to just help that much more, then I want this. So I think it's a very personal question that needs to be answered on your terms to see if this is something that you want to try, that you're ready for.
Yeah, and I would just add to that. I think patients really need to understand the process. As Dr. Ko mentioned, set and setting is very important. So that it's important that patients are in the right mindset, they're ready to receive the medication, they're willing to do the work and all that's involved outside of these infusions. But again, it's important that they're comfortable with the team, the physical environment. They ask the difficult questions, they talk to their loved ones, their healthcare team, because this is something that shouldn't be taken lightly. A little bit of preparation goes a long way.
Thank you all. And then the next question I will answer, it's how does ketamine therapy work for migraines? So I'm going to click answer. That's a really good question. So ketamine seems to reset pain receptors in the central nervous system. And the etiology specifically for migraines, it's kind of complex. There's some neurological reasons that occurs. There's some vascular reasons that it occurs. And ketamine is kind of a unique drug in that it's not only working on one receptor, the N-methyl D-aspartate receptor, but it's working on a host of other receptors, such as the dopamine, serotonin, opioid. So because migraines can be quite complex and from multiple sources and reasons that the patient is getting migraine, ketamine seems to work in kind of a multimodal fashion. The other thing is that with migraines, we look at the evidence behind that, and migraines can be incredibly challenging and very, very painful, as you're probably aware. And it's not necessarily a first line treatment for migraines, but if someone has already tried the standard regimen, it's definitely something for you to consider. How often, this is for Dr. Rivas, how often do people need to stop partway through an infusion? And if they do stop, why would someone need to stop?
Yeah, it's a great question. Pretty infrequently do people stop infusions. It's important to note that you're not sedated, you're conscious, you can move, you can talk if you choose to. However, sometimes when the dose is increased specifically for pain infusions, it can be a little bit confusing. It can be confusing, forgetting why you're there, what you're doing. In regards to people who's requested to stop their infusions, for our clinic, it usually just takes a little bit of redirection, just reminding them, hey, you're here for your pain, you're okay, you're safe. And typically they're like, oh, okay, let's keep going. So it's simply, sometimes it's, again, like I said, just a little bit confusing versus some type of medical emergency. Ketamine is a very, very safe medicine. And we're not using anesthetic doses, but instead sub-anesthetic doses. And even at the anesthetic doses, very effective medication, very safe medication, not worrying about, breathing issues, not worrying about affecting your heart rate, blood pressure, but still important, obviously, to be monitored in close setting.
If I
Thank you.
may add to that as well, is that's why we always start with a low dose. We start with a low dose so we can gradually increase it so that you can see what the medicine does. You can get comfortable with the medicine, and it's very personalized. So somebody might be good at 60, 70 milligrams of the medicine. Somebody might be good at 120 milligrams of the medicine. So I think that also, if you take that into account, you are comfortable with it so that there is less chances of wanting to stop middle of the session, and that the setting, again, going back to that, as long as you know where you are, you feel comfortable, you trust that I as a physician can handle anything that might come up. I think that also plays a big factor in it.
Thank you so much for that. Okay, so this is for Dr. Imani. So after the 6 initial treatments, what do you say to a client when they ask, how many boosters will they need and when and how often?
That is a good question because it's, again, very personalized for me at my clinic, because I usually say I will follow up with you in a month, see how you're doing. Because if you need a booster session at that time, we can set you up. If you're doing great, you want to go 3 months, you're you're good with what's happening and what's going on in your life, then we can set it up at 3 months. And I have one person that goes every 6 months and comes back for a treatment for a booster session. So it very personalized, very depends on the person.
Great. Thank you so much. Let's see here. Can ketamine be used after heroin addiction? Yeah, thank you for that question. So, ketamine is potentially known to be a drug of abuse. So, we had talked earlier about misuse versus use appropriately. And so, if someone has a history of substance abuse, it is something to be aware of that it could create an impact. Now, the thing here with our clinics is in general, we're focused on IV ketamine at the clinic with medical professionals, meaning that someone isn't necessarily going home with, their own needle and vial of ketamine and using it on their own. They're actually doing it at the clinic with medical professionals constantly being monitored. So this plays a role in reducing the chances of that. And what's fascinating is the scientific data is showing that ketamine may actually be used for people with history of substance abuse disorder. So, for example, there's some research happening in London with alcohol use disorder. There's some research happening in New York, Columbia University, where they're using it for cocaine use disorder. So, ketamine seems to be an interesting drug in that it can not only be addictive, but it can actually be used to treat addiction. Okay. This one is for you, Dr. Rivas. So please share how you emphasize the aspect of integration as part of or following ketamine therapy.
Yeah, so integration starts actually before starting the infusions. At my clinic, we utilize psychotherapy. It's a requirement, and the patients will first see a psychotherapist to help understand the issues they struggle with, help them prepare for these infusions, help them understand the process, set intentions. Intentions can be very powerful. And then the integration work continues throughout the process. So we really encourage the more integration work, the better. So after each infusion, if the patients are able to, we schedule them with our psychotherapist to, again, integrate the insights, the gifts that the medicine can give them, because it's really about making lifestyle changes, improvements on habits, letting go of unhealthy habits, triggers, and whatnot. And so the psychotherapy is one part, but so is the work they need to do independently. We always encourage people to make improvements on their sleep, their nutrition, their social support. So that carries forward long after the infusions end. So, we're really stepping away from the model of treating ketamine like any other medication you take daily without much thought. It's really about using the medicine as a catalyst, as a facilitator for long-term changes, changes that require work. That's the key. Is this is not going to be necessarily a smooth road for everyone. It's going to be bumpy. It's going to be challenging. It's going to be difficult, but it's work, and it's definitely worthwhile. The more work you put into it, the more you get out of it.
Great. Thank you, Dr. Rivas. And then these are awesome. We have amazing questions here. And what is the mechanism of action for the anti-inflammatory effects of ketamine? So ketamine seems to rapidly reduce inflammatory markers, in particular, one called TNF alpha, tumor necrosis factor alpha, interleukin 6, interleukin 1. And a lot of it is seen more in animal models, so like horses and rodents. And that can also be applied to humans because we are all mammals. We're all, physiologically a lot of similarities. So ketamine seems to affect, in particular, the inflammatory molecules that occur. And so we've actually seen patients at our clinic. So one example is someone with rheumatoid arthritis, where they had a lot of joint pain, like pain in the knuckles and fingers. And there was literally like you could see the swelling. Post ketamine, they had mentioned that their inflammation went down dramatically. So the specific mechanism of action, to bottom line it, is it seems to be affecting those specific inflammatory markers, which is really interesting because you may have even seen on TV commercials. There's like, hey, there's this new anti-inflammatory thing. And those are all medications that target these inflammatory molecules. Let's see here. Dr. Imani, can you share any success stories where, a patient had certain symptoms and ketamine was able to drastically help them?
Yes, absolutely. There's a lot of success stories. I think one that comes to mind is from a client that I had recently who had alcoholism, and he came in here skeptical. And he was coming in because, I mean, this was pretty much the last resort, right? He has tried other things. He's been to detox, and this is something that was pretty much suggested to him that he should do this. So he started the first couple sessions, and then once we started talking, I was like, okay, you really have to want to be here. You gotta come in with intentions. So he was like, okay, I'll play along. And after 6 sessions, he's like, I don't even think about alcohol. He has more energy. Life has just turned around for him. He looks different. He looks like more upbeat. Just amazing. Amazing after 6 sessions. And I think recently I showed him his graph of his, the measurements that we do, the GAD-7 and PHQ-9, and he was amazed himself. So I think that's a great story.
Awesome. Thank you, Dr. Imani. So, all right, Dr. Rivas, if someone tries ketamine therapy and they don't have an immersive positive experience, can it still be effective? Actually, they didn't put in the word positive. They said, if you try ketamine therapy and you don't have an immersive experience, can that still be effective?
Yeah, absolutely. No, I've had patients who have undergone the series of 6 infusions, and it ranges anywhere from being very blissful, very enjoyable to nothing. I've had some patients have no dissociation, no effects at all during the journey, but the journey is just one part. The real purpose of the infusions are to administer the medicine safely, comfortably, but the neuroplasticity, the healing, the structural functional changes happen afterwards. That's within hours, days. So, people sometimes get very hung up on the experience. It's usually one of two experiences, one that may feel very meaningful, filled with insights, motivations. It can be very exciting for them. And in those cases, I think those are gifts that they can use independently or with their therapist. But other times it can be random and weird. Ketamine is not technically a classic psychedelic, but it does have some psychedelic properties. So people sometimes have the sensation of movement, they see colors, they have weird feelings or emotions. But I tried to tell people that, that's just part of the process. That's just your unique experience. And should it not seem very meaningful or filled with insight, that's okay. That's not really the goal here. We're not really focused on experiences. We're focused on what happens afterwards, the healing.
Wonderful. Thank you so much. Okay, I think I'm going to answer one. Is the VA using ketamine treatment? Because that was one of the earlier ones asked. Thank you for asking. So, one of the things I learned about the VA is that every VA, even though they're all under the VA administration, they kind of function independently, which means that some VAs are using ketamine therapy and others are not. So this one was kind of confusing to me because I thought every VA did exactly the same thing, but it turns out they kind of act in their own kind of little silos, believe it or not, in the government. So yeah, so does the VA use it? Yeah, it depends on which VA you're going to. Now, what's fascinating is there was a recent publication specifically from the clinical guidelines from the Department of Defense. And in that publication, they recommended IV ketamine as part of their treatment protocols, in particular for depression and suicidal ideation. So again, this is kind of the clinical guidelines from the DoD. Not every VA is going to adopt it because they have the ability to function independently. Thank you for that. Next question for Dr. Imani. This is really interesting. So is it recommended for patients who have cancer and they're dying, so terminal cancer, but they request it? What would you say to someone who's like, hey, I have cancer, terminally stage 4, let's say, and they're requesting it?
Absolutely. I would say absolutely, because it helps them with that end of life. And I've had patients recently that they tell me that they have seen death and they have even seen themselves die multiple times. And I think it just gets them very comfortable with that aspect. I've had other clients that, they say that, you know what, I am grateful for the life that I've had. I think that it helps them become very grateful, peaceful, make peace with everything, pretty much just have that love that everyone is connected. And even though you're leaving this world, the world of, you know, materialistic world, you're going to another world, we are still connected.
Thank you. And Dr. Rivas, because you had spoken about the future of ketamine, do you know or foresee how the at-home ketamine administration approach would work?
Well, I mean, right now, it's really up to the patients to dictate their own care. So the model right now is, patients get delivered ketamine, hopefully with some type of guidance, some type of screening. Sometimes I know that these at-home ketamine models will have a provider, either virtually or over the phone, some sort to guide them through the journeys. And yeah, so I mentioned before some of my concerns with the at-home ketamine. I also mentioned how there's potential here for improving access, affordability. So I think that the more ideal scenario, if people were to choose to use it at home, for example, patients who have chronic pain or cancer who just can't leave the home, is to still have a provider there on standby. The next best option would be to have a trusted individual, like a family member, who could be close by should an emergency come up, who can, direct them to the hospital if something were to happen. I just am really worried, or really don't like the idea of people using ketamine alone, and again, deciding when, how often, and how much to take.
Thank you. Okay. So I think it's my turn. So this one is regarding how close do you think insurances are to covering ketamine treatments for mental health? So good news and bad news. The bad news is that insurance companies, they still consider this quote too experimental to be covered. They say, hey, it's off label, there's not enough research, etc. So that's kind of their reasoning and justification. The good news is that there are some insurance companies that are becoming more enlightened. So for example, Dr. Rivas had mentioned a company called Enthea, and they're kind of a niche insurance company. They work with Dr. Bronner's, for example, where they cover IV ketamine therapy for Dr. Bronner's employees. So I think things are changing and shifting in the ketamine space. I do also know that Massachusetts Blue Cross Blue Shield, again, just in one state, they are covering IV ketamine therapy and or Spravato for patients for those mental health treatments. So bottom line is that it is changing, but it is happening slowly. I have a colleague of mine, and one of the biggest hurdles is that the insurance company says, hey, it's not FDA approved. Well, what's cool is that they're working on a research project in Florida. And I think they got like a $10 million grant to do this research study to meet the qualifications to become FDA approved. And as you may or may not know, once something becomes FDA approved, then insurance companies are required to cover it. So I have another question here. So let's see here. Dr. Imani, is the dosing and duration of ketamine different for mental health and pain?
Yes. Oh, I need to tell more. Okay. Yes, it is. For mental health, for mental health, it's you start with a lower dose and you do more about a 45-minute session. And then for pain, we start with 0.5, but we start going higher doses, longer sessions, anywhere between 2 to 4 hours, depending on the diagnosis. And also for the pain, it's consecutive days versus for mental health, we do 2 sessions a week. Most of us, I believe some clinics might be doing 3 sessions a week, but I think most of us, the three of us here, we do 2 sessions a week for a total of 6. And the 6 is not like hard science. I think anywhere between 6 to 8 sessions is right, because some people might be able to work through their problems that they have, or things that the places that they're stuck in within 6 sessions, and some people with 8 sessions is where they really get that aha moment at the end of the 8th session.
Yeah, you bring up a good point there too, as far as what came to mind is the types of responders. Some people respond right away, after 1 or 2 infusions, but some people take 4, 5, 6 infusions to have a response. So in that case, sometimes we do choose to extend the series to 8 or 10 infusions because, as the benefit starts to take hold, it's nice to keep that momentum going.
Great. Thank you. And for Dr. Rivas, how do I know that I will not become addicted to ketamine? I think this is kind of an important question because again, we had mentioned the misuse of ketamine. So how does someone know that, they won't become addicted to ketamine?
Yeah, I think the key there is to use or to do ketamine therapy under guidance and supervision of a licensed professional. So we have control, when you come to our clinic, we decide the dose, we decide the frequency, the duration of the infusions, and we decide when to stop. There are a percentage of people who don't respond to ketamine. They either don't have a robust antidepressant effect, or they potentially could get worse if we didn't properly screen them for contraindications. So I think that's really the key is, to limit the at-home use model, limit using ketamine not under supervision. Ketamine is not physically addictive, meaning you won't have withdrawal symptoms from stopping it. But certainly if you make your own decisions when to use it, I've seen this with people. They may take ketamine during a depressive episode, and then it's in anticipation for a depressive episode, and then it's to relax. And that really just opens the door for addiction.
Thank you. And then I'm going to answer one here. What kind of adverse reactions have you seen and observed and handled? So, I really appreciate that question because there are side effects. Every medication has its pros and its cons. And some of the ones that we've seen are hypoxia. So, literally, the patient's oxygen levels are dropping during the infusion therapy, which is why we monitor our patients to make sure it's safe. More commonly, nausea, maybe 5 to 10%, headaches post infusion, also 5 to 10%. And for those, we can either treat them with a medicine called Zofran, aka ondansetron, or Toradol, which is an NSAID, Tylenol, safe to use. So those are more of the common ones I've seen. Also, I've seen blood pressure get quite high, which is one of the reasons why one of the contraindications is uncontrolled hypertension. We want that to be nice and stable. And then I've also seen some other things which are pretty rare, but has happened. I mean, I've been doing this for 6 years now, and I've seen something called atrial fibrillation with RVR during the infusion. And that's kind of a rapid, irregular heartbeat that can precipitate. And because ketamine is a slight arrhythmogenic, meaning it can potentially trigger some cardiac arrhythmias. And that's the reason we also monitor all the patients with cardiac monitoring to make sure it's absolutely safe. I've also seen someone have a seizure during their ketamine therapy. So those are some of those adverse reactions that I've seen. What else? Panic attacks. Sometimes if someone hasn't prepared or if they have something scary, that can occur. But again, as I mentioned earlier, the nice thing about IV is that we can stop it at any time. So if someone is having any of these adverse reactions, we can beep, hit stop on the machine, and then the ketamine effects will fade. Are there any other adverse reactions that you've seen that I didn't mention? Dr. Rivas, Dr. Imani?
Yeah, one I've seen in the OR or after surgery is laryngeal spasm. That's a super rare, about 0.3%, not likely to happen in the clinic, but doesn't mean it can't happen. And that's basically the airway will get closed off, and the provider needs to do a certain maneuver to lift the jaw to open up the airway. So that's very, very rare, but a potential.
Awesome.
I think the only other one that I've seen in the emergency room, not necessarily in the clinic, is when it's given too fast, and that can causes respiratory depression. But that's the only time that I've seen any type of adverse reaction. I do want to piggyback on Dr. Rivas's previous question. I wanted to just mention about ketamine and addiction. It goes back to the analogy that Dr. Ko covered in the presentation, the analogy of driving a car. It's really the person who's driving that car, right? And you can be a careful driver or you can be a reckless driver. So I think that really just reminded me of that.
Great. Thank you. And I'm going to throw another one at you, Dr. Imani, if you're up for it. And do you need to stop any medications the morning of your treatment, specifically benzodiazepine or pain medications?
I would say yes. There's certainly, definitely, absolutely. Some medications, I don't know if I would use too many words there that actually means the same thing, but you do want to stop benzodiazepines. I usually have like a preparation call with my clients that I tell them, no alcohol within 72 hours, or no marijuana, no mind altering medications, pain medication if they can refrain from taking it the day off, that would be great. But some people are in pain and they need to take it, so that's fine. But benzodiazepines, definitely they should stop taking it the day off as well. And then another one is lamotrigine, which is used for some psychiatric. So that needs to be stopped at least 2 days before as well.
Great. Thank you. Dr. Rivas, since you had mentioned ketamine assisted psychotherapy, I'll put this one for you. Would you recommend someone be actively working in psychotherapy to use ketamine for service related PTSD?
Yes, absolutely. No, a lot of patients that we see, they have a therapist already, which is great. I think they should, obviously continue to see their therapist, but also it's, ketamine assisted psychotherapy isn't just routine psychotherapy. It's just with a trained specialist who understands the medication, who has perspective with it. In regards to PTSD, a lot of it is reframing maladaptive behaviors. The majority of literature revolves around antidepressant, but there is obviously research showing its effects for PTSD, and it's a little bit different mechanism. But I do believe the psychotherapy is very important because, as Dr. Ko mentioned, the infusions, the ketamine can be like a reset for a lot of people. But if someone doesn't have the professional guidance on making changes, they're more likely to do what they did before, and they'll fall back into the behaviors that are not healthy or not working. So it's really about taking new tracks, making different steps, and the therapy is really key to help with that process.
Thank you, Dr. Rivas, Dr. Imani. So the sun is setting on the webinar. So we have a few more minutes. And again, we do want to honor your time because, it's in the evening. So we really appreciate everyone. And we do want to finish at the hour mark. So for the last 5 minutes or so, we're going to just wrap up. And I'm going to give every one of the panelists to an opportunity just to have some final thoughts or words, and let Dr. Imani, if there's any final closing thoughts as we wrap up, and then I'll switch to Dr. Rivas and then myself, and then we will wrap up the webinar.
I would just want to say thank you, everyone, for attending, spending your evening with us. I'm glad we were able to answer most of your questions. If you would like to reach out to us separately, you have access to our emails, phone numbers, and I hope you found this webinar helpful. Thank you all, and have a great night.
Yeah, I just wanted to thank everyone for joining in today. A big key here for us is awareness, education, addressing misconceptions. So please do share this with others who may benefit from it. And don't hesitate to reach out to any of us if you have any questions about ketamine therapy.
And for my final closing, I just want to say thank you. The fact that you've stayed here till the very end says a lot about your curiosity and your interest and enthusiasm about this kind of cutting edge novel treatment. It says a lot about you. We really appreciate you spending the time being here with us. And one of the reasons why we're here and educating is because there may be some myths and a lot of stigmas associated with ketamine therapy. But again, I think it can be really transformational. It's not 100% effective, but the results that we've seen in our patients, it's been game changers. And when it works, it really, really works. And we've seen that effectiveness. That's what keeps me motivated. And we would love for you to share, with if you have someone who's, whether it's yourself, whether it's your close friend or family member, just let them know, hey, this is something for you to consider, and at least let them know that there is hope. And it's very, can be potentially very effective and very transformational. So, as I mentioned, we promise we will email you a recording of this, and all of our contact information will be there. Dr. Imani is in Goodyear, Arizona. Dr. Rivas is in San Luis Obispo, and I'm in Palm Springs, California. So feel free to reach out to any of us if you guys have any additional questions. And with that, we will wrap up. Thank you all so much for being here, and have a great evening. Bye.